Hey everybody, it's Curtis coming to you from the Premier Team. 2021 has finally come. New year, new you. We have 4 brand new videos to start off the year. Part of our wellness wheel. We have first pain science, then we have benefits of strength, benefits of cardiovascular exercise, and to wrap it all up, we have balance. Today we're going to talk about pain science. So the current ways to manage pain aren't necessarily the best ways. A lot of patients I know and have heard of going to pain management centers typically get injections and maybe receive medications such as opioids, but those aren't necessarily the best ways to treat pain. And there's a big time opioid crisis, and in 2017 nearly 70,000 people died from drug overdose, and opioids were a big part of that. So we want to start off with talking about some neuroscience, just some anatomy, and about your nerves and how they function in your body. So basically you have a tissue injury that sends input through the nerves to your spinal cord, which travel up to your brain, gets processed, then it gets output through some nerves, and then there's an action response back to the level of the tissue injury. And that's just the simple way to put it. A lot of things can complicate that process. But you have receptors in your tissues. They could be in your skin, your muscles, your joints, a whole bunch of places. And what they do, they detect different things. Some detect light touch, vibration. They can detect deformation of your skin, heavy pressure on your skin. Some give you input into what's called your proprioception, or if your joints are moving. And there's also nociceptors, which tell you if you're experiencing pain. And what these do, like I said, once you get some of these receptors, particularly the nociceptors working, they'll send input to your brain, and then your brain has to process that information. And sometimes if you're having some people have some cognitive deficits or some psychological things going on, it can do things to that input. It can make the pain seem worse than it really is. But there are also benefits when it gets to that processing center. You can release endogenous opioids, or your internal medicine, and it's going to go out to that tissue and start making your body feel better. So there's positives and negatives to it. So if you came to therapy with pain, we want to diagnose what's going on. There's a whole bunch of different types of pain, and they're all treated differently. So the first type of pain is nociceptive pain. And a lot of what I'm going over, we learned from a gentleman. He's a physical therapist, and he does pain science lectures, but his name's Joe Delaney. And he's very big on the pain science and has excellent videos. And he's provided us a lot of education through his lectures. But basically, the first type is nociceptive pain. It's the basic normal type of pain. It's like if you sprained your ankle is the best example. And when you sprain your ankle, your body has some tissue damage, and it releases some chemicals in the area, and it causes some swelling. And then eventually you have these cells called phagocytes that eat the loose debris and tissue that's floating around in your body. And then eventually that tissue gets repaired. And usually the timeline for this is about 4 to 6 weeks, but never really longer than 3 months. We call this an acute tissue injury with a normal healing time, and you treat it, with ice, compression, elevation, and you do eventually some exercises. And if it's very painful, you can use biofreeze or a TENS unit. So another type of pain is neurogenic pain. This is where your nerve tissue is injured. And this could be from a nerve root compression, it could be from diabetic neuropathy, stuff like that, injuries like that. And basically they're going to feel like a nerve pain. You're going to have electrical pain, burning pain, tickling pain. You might have muscle weakness. You might have impaired sensation like numbness. And also you could have a condition called allodynia, which is basically non-painful, usually these non-painful receptors will cause pain. So for example, light touch will cause pain. And that's a part of this neurogenic type of pain pain injury. And then you have the third category, it's called nociplastic or central sensitization. And basically, the pain at this point is solely coming from the spinal cord or the brain itself. And this is very unpredictable pain, widespread. It can cross body parts. It can lead to a lot of fatigue. And the best treatment for this is you could do a couple things. You could do exercise and manual therapy. You could do TENS units. But a lot of it's basically some patient education. You can even take some antidepressants also. But that pretty much sums up our pain science lectures. I hope you learned something, and stay tuned for more videos in the future.